Good morning, America, and welcome to this morning's Going on Offense webinar. My name is Daryl Moon, and I'll be your host today. This is our second webinar of this new series on aspirational healthcare. The sponsor of this series of webinars is a very uniquely proactive mental health and personalized well-being program called Resilience Pro. As the COVID pandemic has certainly upended the lives of most Americans, and most businesses in this country have drastically been impacted, these webinars have been focused on going on offense to address the impact of the pandemic and its impact on both emotional well-being as well as people's mental health. This idea of going on offense and being proactive to prevent problems before they occur versus fixing something after it occurs is really the foundation of aspirational healthcare. Instead of solving a problem, look to prevent the problem. Instead of treating a disease, how about avoiding the disease in the first place? Well, the very best healthcare system in the world is South Central Foundation's Nuka system of care, which is the best example of an aspirational healthcare system. They're the only healthcare system that has won the President's Malcolm Baldrige Award twice, once in 2011 and again in 2017. Countries come from all over the world to learn how the Nuka system of care can be so much better than all the other systems, half the cost with far better outcomes. I'm very pleased to have as my guest panelist today a representative from the South Central Foundation, Rachel Saldana, the Senior Business Development Advisor for the Nuka Learning Institute. Rachel, thank you for joining me today. And would you like to take just a couple minutes and introduce yourself?
Absolutely, and thank you so much, Daryl, for having me on the call this morning or afternoon for you. I'm excited to be here all the way in Alaska. And, you know, my name is, as you said, Rachel Saldana. I'm one of the Senior Business Development Advisors here at South Central Foundation Nuka Learning Institute. I have been working with South Central Foundation for 10.5 years, and my role in the Learning Institute is working with external clients interested in learning more about our healthcare system and the work that we do here at SCF that makes us so unique with a relationship-based focus and servicing 65,000 Alaska Native American Indian people.
Well, and let's start maybe, Rachel, by sharing how did you get involved in the first place? How long have you been involved in this system, and how did you first get involved?
You know, it's really funny, Daryl. So I am a tribally enrolled Samish Indian tribal member out of Anacortes, Washington, and I have been a customer owner within the system. A lot of people wonder what a customer owner is. That's what we refer our patients to, is that they're customer owners within the system. At the time, you know, as a young teen, I was first starting college and I had come in to get a dental cleaning, and the hygienist at the time said, "Hey, I see that you're going to college. What are you doing?" And I said, "Well, I want to be a dental hygienist, but you know, I'm, you know, just finishing up science prereqs." And she said, "Oh my goodness, you would be fantastic. You need to join our dental assistant training program. We're partnered with the local university here. You would be able to meet, connect, build relationships with those folks, and get an idea of how our system works." So I said, "Sure, I'll try it." I ended up doing the 5-month program, became a dental assistant, got to travel out to some of our remote villages, work directly with our customer owners. Here in Anchorage is our main hub location. And it was a lot of fun, a lot of really great opportunities, learning to work with our customer owners, learning all of the different unique challenges that we face here in Alaska and servicing customer owners. But one of the things that was exciting was as I learned that dental hygiene was not my path. And at the time I had a manager that was really passionate about, growing our own, helping me to develop my skills, and said, "Hey, you're great working with people. Have you ever thought of healthcare management?" And so that kind of led to my path of healthcare management. And then I worked in quality improvement for dental services for a few years, and then was recruited into the Learning Institute, kind of acting as our on a sales role, working with our system, working with folks interested in learning more about how they could partner with us to implement services and things that we're doing here at SCF in their system.
Nice. So give us just kind of an overview of what is the Nuka system of care. I know that you've basically taken healthcare and turned it upside down, but I'd love for you to share a summary of what is it?
Absolutely, I'd be happy to do that. So South Central Foundation, Nuka System of Care, I truly believe started back in the early 80s when we took over healthcare from the federal government. So that's, we tribally compacted and stated, hey, we are ready to take over the funds from Indian Health Services and turn this into something that we want our healthcare system to be. And in doing so, our leadership at the time, we've had a lot of longevity in leadership. A lot of our VPs, CEOs have been here, 20, 30 plus years. So they had a vision, and it was, what did the customer owners want to see in a healthcare system? And so when we did the community needs assessment at that time, they said, customers, what do you want to see? Some of the things were, hey, we want better access to care. We don't want to, be in the emergency room for 9 hours waiting to be seen by our provider. We want to know that, we're being heard when we, see our provider. We want to know that our voices are heard, and not only that, but our opinions matter, and we have voice in the services that we receive. Another thing was cultural. We want to feel that our culture is respected. We don't want to feel ashamed about sharing our culture and sharing, the services and, things that we can bring to the table, both traditionally, non-traditional, to healthcare. And so when, we really looked at those things, a lot of social determinants as well, suicide, domestic violence, child sexual abuse were the highest in the nation for those things. And a lot of folks don't realize that. And that was something that our community was saying, hey, we want to address these things at, a forefront. And so at that time, it was, what does redesign look like? How do we build it around the customer owner's needs? And we consistently kept that in mind. When you look at the mission vision of our organization, our goals are a Native community that enjoys physical, mental, emotional, and spiritual wellness. It's a whole person-centered approach to how we look at our customer owners. Not only that, you look at our goals, our operational principles, spell out relationships. So everything that we do here at SCF is about relationships around the family. I love, as a customer owner, my provider, he knows me, he knows my dad, he knows my sister, my brother, and he laughs, he says, I will never test you guys for your vitamin D levels because I know you guys all have ridiculous vitamin D levels. And, so it's just funny because, we have that really great relationship, not only as a family, but he knows us, he knows kind of our background and history. And so SCF is just a special place in that we've developed integrated care teams. So as a customer owner, I have direct access to my nurse case manager. I can call her at any time. I remember as a new mom, not knowing or feeling confident in my skills and what I was doing. And so I would call my nurse case manager and be, hey, is this normal that my baby cries about this? And she would just reaffirm me and tell me, yes, you're doing the right thing, Rachel. And so just knowing that I had that ability and that someone to rely on, in my time of need. And not only that, just having access to care. I mean, I have never experienced in, my 30 plus years on this earth that I've always had direct access to care. I can call and have an appointment same day every single time. I not only have access to my provider team, but I have access to dietitians. I have access to case management support, psychiatry, behavioral health services. All of these services are right at the hand, and I don't even have to leave the clinic. So I think that's what makes, SCF unique is we've really kind of reevaluated what are the services that we offer and how can we best, make that accessible and easy for our customers.
Fantastic. I love the fact that it's so focused on the person.
Yes.
Dr. Evie, Vice President of Medical Services, uses the comment that traditional healthcare, like we're used to in the lower 48, is very much the medical institution is there with all the knowledge and science, and people come to it to be benefactors of it, and generally after they fall off the cliff. Where what Nuka's done is turned that upside down and said, no, what if we actually put the customer owner as the focus and the healthcare system is there to support them? And I think, gee, having run hospitals in the past and having left the treatment side, it's like, that's what we need. We need a system that's focused on the person, not on the system, and people just coming to be the benefactors of the system and the relationship. So, his comment and your comment about a very integrated primary, I love how he describes a massively powerful primary care system. And one of your one of your pillars that you built from the very beginning based on your studies of what the customer wanted was that it's immediate access. You know, if someone needs healthcare, they don't need to wait 5 days or 3 days. Your commitment was give them a team who knows their situation. They can call somebody on that team and get access immediately. I think it's like, wouldn't we all want healthcare to work that way?
I know. Absolutely, absolutely. You know, I even laugh. I always love to tell this story. I mean, our provider teams are so interwoven into the relationship piece. I one time was in the airport flying back from Portland, Oregon to Anchorage, Alaska, and my provider saw me in the line on the airplane and said, Rachel, I have been trying to get a hold of you. You're supposed to come back and see me after your blood work, and you haven't called me yet. What's going on? And I was like, I'll call you on Monday when I get back.
That
But I mean,
speaks
that's how,
volumes. That
yep.
speaks volumes. And the only way that happens is if your primary care provider doesn't have 5,000 people in their
Absolutely.
practice, which is, you know, 3,000 to 5,000 people is not uncommon, you know, in a deficit-based healthcare system, because you're only helping the people who have a symptom today and show up for a quick, you know, diagnosis and a treatment plan. Where in your system, what's like 1,000 to 1,200 people per provider, and it's proactive. It's like, okay, I'm going to get to know. I love the storytelling of your culture and the way your system works. It's about, tell me your story. I want to know you. I don't just want to know what the pain today is. I want to know your story. Like in your case, they know that your whole generations, you know, good vitamin D. It's
Yep.
getting that kind of relationship back into healthcare that's so exciting and so neat about what you've developed.
Absolutely. And you know, I think too, one of the unique things with SCF Daryl is we spend a lot of intentionality and time with our employees in training them in relationships. You know, one of the big things that we do have is our core concepts training, which is a 3-day training where we just talk about relationships. What is your story? What's my story? How does your story impact who you are and how you respond to others? How does my story impact how I respond to others and how I interact with other people? And so there's a lot of intentionality and things that we do around training and making sure that our employees are equipped to build relationships with our customers in a healthy way, in, you know, responding to their stories and listening to what they have to say. But then again, that also translates into our employee interactions. You know, we have a 95% employee satisfaction, 97% customer owner satisfaction rate. And I do believe it is because SCF spends a lot of time in focusing on that relationship piece and how we build those.
Well, and let's talk about why that's so important. And I love the analogy that Dr. Eby uses of the rock and the target. You know, culture is so often built around it's a science, and we're going to figure out the best science to deal with the problem. And if I'm comatose and end up at the emergency room, it's like, yeah, apply all the science you can because I'm out. You know, put me back together again. But that only represents 20% of healthcare. If you really look at the full spectrum of healthcare, 80%, and of course the analogy is that the 20% is throwing a rock at a target. And I can get really good at throwing a rock at a target and hitting it because it's science. But the other 80% is like throwing a live bird at the target.
Yes.
It's like that bird's going to go where that bird wants. And I can throw that bird as many times as I want, but unless I build a relationship, unless I really understand how important it is to drive behavior change and how important it is to understand where the person's coming from, so that you put the birdhouse at the target and they want to feed the babies at the target. Right? You gotta approach the 80%. And quite honestly, I have been for years feeling like that's the biggest miss in deficit-based healthcare is it's all science. It's like, let's give all the accolades and all the training, you know, with the best science as possible. And yes, that has a place, but we're missing the 80% that gets to where the person is and helping the person make a change. And they're, like you said, they're the customer owner. They have control and they're going to go where they want to go. And you can provide the best treatment plan in the world. But as I don't know if you call it your motto or your mantra, but I love the thing that it's more important to engage change in every interaction with the participant or a member than it is to create the perfect treatment plan. I love that concept. It's an appreciation for the 80%. That's where
Absolutely.
healthcare needs to go.
Absolutely. No, 100% agree. And, it just is truly amazing to see, the work that we've been able to do in just being able to listen and for people to feel heard. And that's where, a lot of the training comes in is, when I'm sitting there hearing somebody's story, maybe they're telling that story for the 100th time or, whatnot, but how am I interacting? What is my body language telling them? Am I engaging in what they're saying, or am I, sitting typing on my computer? How am I engaging with them? And those are some really important components to, making sure that people feel heard and that you're invested in what they're saying.
I've used the analogy many times that deficit-based healthcare, which is what we're so used to across the world, is like driving a car with 4 blown out tires. And often we're driving it in the wrong direction.
Yes.
And those 4 tires are primary care is badly broken. We don't help people navigate and advocate for people through this very complicated system. We're not helping people change behavior, which is the root of almost all healthcare problems. And we're not addressing mental health appropriately, which is the #1 biggest risk factor. And when you look at what the Nuka system of care has done, it's like we filled up all 4 tires.
Yeah.
We've driven the car in the right direction.
Absolutely. You are correct. You are correct.
So congratulations. So I want to ask attendee, or just mention that if any attendees have any questions during this webinar, please feel free to ask those questions. I'll read them and we can address them. But let's take some time right now, Rachel, and talk about your upcoming conference. Let's talk about when it's happening and a little bit about the conference.
Absolutely. So we have our annual Nuka conference that we normally host in June in Anchorage, Alaska, but due to COVID and the pandemic restrictions of travel and just maintaining safe distance, we've gone virtual. And so we have our upcoming conference, February 8th, 9th, and 10th is our general Nuka conference, where folks can kind of just get a deeper dive into overall what our healthcare system looks like. We'll have different components, not only learning about an overview and history of our organization, but kind of just diving deeper into some of our primary care integrated models, how we've integrated behavioral health services, human resources, our strategic planning process. A lot of people, I always find it interesting, but a lot of people are always like, well, how are your integrated care team panels set up? Like we want to know the numbers, like how many impaneled, how many, what's the ratio? And I always tell people that it's so interwoven that you won't understand how interwoven it is. It's not just numbers, it's interwoven into us onboarding employees, how we integrate human resources, to how we integrate trainings into our primary care team panels. And it's so much more complex than just, hey, we've got 4 people working in a room together as a team and they're going to manage this panel. So being able to come to the Nuka conference, you're going to get a better understanding of how all of our key work systems are interwoven together to create the Nuka system of care. So it's a great opportunity. But after the general conference, we do have some intensives. So I talked a little bit earlier about core concepts, which is our relationship-based training on how we approach relationships at SCF. So we're doing a 2-day intensive, and that's on the 11th and 12th. Great opportunity to learn about how we share story at SCF, how we engage in story and respond healthy and to that story. And then we also have an integrated care team intensive as well that's taking place simultaneously with that core concepts training if folks are interested in diving a little bit deeper into how our integrated care teams are structured and what those roles and responsibilities look like.
So share kind of the structure of an intensive. Is it going to be like a Zoom meeting where everybody's kind of on a virtual interaction? Give me a little bit of idea as to what that intensive looks like.
Absolutely. So our intensives, again, you will be on a Zoom, but we also, we do some surveys ahead of time. So there's some intentionality around understanding kind of your personality. So we do a personality test prior to participating in that integrated care team model, just to be able to understand how you work with others, what your work styles are, and whatnot. But then also when you come into the training, again, you'll receive a little bit of history on integrated care team model, understanding kind of the ins and outs, but then we'll also be separating you guys out into groups. So you'll be having some group discussions, possibly some matching and mirroring, some conversations around what does primary care look like at your organization and what components you could potentially see integrating into yours. So a lot of different pieces, but a really great opportunity to dive a little bit deeper into what our integrated care team model looks like.
And who are the people that generally attend? Maybe share what are the different kinds of roles that would be good to attend that, both the conference as well as those intensives.
Absolutely. So our general conference, I always say anybody is welcome to attend. A lot of organizations, when they do come to visit with us, they bring, CEOs, directors, administrators. Leadership is always great to receive buy-in to see if this is the healthcare system that you would want to adopt for your organization. And then a lot of our intensives are great for your operations director for primary care, your administrators, some of your clinicians, nurse case managers, case management support, maybe even some of your entry-level admins, because again, all of those roles play an important part in the integrated care team. And then also in our core concepts intensive, that's open to anybody. If you have entry-level staff that maybe is just, needing some, ideas on how to build better relationships or interact with others, in a more empathetic, compassionate way, though that's a great training for just about anybody. And that's also a training that we do require for every single one of our employees at South Central Foundation to go to.
Nice. So I know that one of the elements of the conference is the culturally appropriate care. Talk a little bit, you mentioned it a little bit, but talk a little bit about how critical, because you've adopted, because it's primarily a population of Native American Indians, or Alaskans, sorry, how do you use the principles you've learned from that to apply to whether it's Sweden or Finland or Canada or United States or, across the world? Talk a little bit about the examples of how you've incorporated, because I love what you've done with all kinds of alternative medicine practitioners, but it's not about mirroring your program for a different population. It's about learning the principles of your program and then applying those to the culture wherever you're going to be.
Absolutely. So in our consulting approach, we have our READY model, which talks about our process and how we work with organizations. And one of our key things is reaching understanding. So we want to get to know you, your organization. What's your philosophy? What is it? What are your goals for your organization? What are the cultural pieces that folks want to see integrated into your system? And then also establishing relationships with key folks in your organization to understand that everybody's on board with this model. And again, our way is not everybody's way, and we recognize that. And we don't expect you to adopt everything that we do, but we really want to make sure that we incorporate the pieces that fit for your system and fit for your people and your cultural components. That's a key thing. But there's a lot of intentionality. I mean, even when we work with an organization, we've had the opportunity to work with some organizations in the US that are opening up their first primary care clinic and need help in facility design, and we go in and talk about how intentional we are around facility design and incorporating cultural artwork and cultural components of nature and things into that building design to make it feel warm and homey for our customers as they enter into the clinic. I know it's kind of a long conversation to go into, but I'll leave it there.
Well, and I think if we look at our typical deficit-based healthcare system, often one of the things that's very common with medicine is I want a health insurance plan to pay for me to go. I want to go wherever I want to go, but because I go to wherever I want to go, it's not very integrated. And I see that one of the big hurdles of really moving into an aspirational healthcare system and to operate a more powerful primary care system is this need to be connected. That it really is, let's connect you with a primary care physician or team of practitioners that are yours and get to know you. So it's not about today go to this one and tomorrow go to that one and the next day go to the other. It's like, it doesn't work if it's like, why do you want to go wherever I want to go? It's okay, well, let's encourage you or help you understand the value of going to someone who's going to get to know you. And I see that as a big difference between what you built and what we have so commonly in the United States. And how do we persuade and share with people the value of having a real team that's your team? And you've spoken about that a little bit, but maybe in closing, because we're running out of time, just talk about what it's been like for you to grow up in this system of care, knowing that you have someone, not just a telephone book, but literally a person and a team of people who know you and your family.
Mhm. I feel blessed. My sister and I talk all the time because this is the only healthcare system we've known. And, when we hear of our friends, talking about their experiences and they're like, wait, you guys receive what? You guys get that? We don't even realize it ourselves how blessed we are to receive the services at South Central Foundation. But one of the, key things that I said earlier was, just having kind of that family network. We all know the same provider. We have the cell phone numbers, we have our nurse case managers. I have them on my phone. I can call at any time. But just changing the way even my kids having those experiences, growing up in the system. I'm still even connected with the OBGYN nurse that delivered both my children at the hospital, and she delivered all my nieces and nephews. So it's just a family. You kind of create this kind of family network, which is really special. But one of the things that I think is so key is behavioral health and mental health needs is such a huge thing right now in our country. And, knowing that, April Kyle, our CEO, she talks a little bit about how as her, son has grown up in the system, how special it is for him to be able to say, hey, mom, I want to talk to be a behavioral health consultant. And she's like, well, why? And he's like, well, I want to be able to wear, not wear pull-ups to go spend the night at my friend's house anymore. And so how we're transitioning behavioral services to not be something that, your auntie or uncle needs, but just, kind of a normal day-to-day
Make it
process.
normal.
Absolutely, make it normal. And, if like my daughter, is struggling not liking vegetables, I can talk to a dietitian and say, okay, I've tried X, Y, and Z. What recommendations do you have? And just being able to have those resources not only helps me as a mom, be a better parent to my kids, but, just in the day-to-day life of, knowing that no matter where I'm at or what's going on, I can call and ask questions and, get the help that I need right then and there. So it's truly a blessing. And I feel privileged to be able to have this opportunity to not only work for SCF, but, be a customer owner.
Well, I'm so glad you brought up the mental health, because we know that one of the biggest challenges of mental health is that people wait 10 years on average after mental health symptoms appear before they're willing to get over that stigma barrier to get help and to reach out for help. Well, that's a huge problem. And that almost 60% of the people never reach out for help. And so
Absolutely.
what you've incorporated as a part of the basics is that relationship to make it not so stigmatized, make it normal, make it okay to reach out to get it to talk to a behavioral specialist. And I think that's just so commendable. And it's one of the biggest risk factors in healthcare, and people not getting the help to deal with the struggles of emotions and anxieties and stresses and grief. It's just an important part of the healthcare system.
Absolutely. And, and I even say too, I mean, there's been times, where I even go into my primary care provider and, maybe I'm stressed with, just life or whatever. And they're like, hey, do you want to talk to somebody today? They can come in and just chat with you. I mean, right then and there. And,
Right there.
yeah. And a lot of times it's just, okay, reassurance that yes, you're doing the right thing, or yes, you're handling it well, or hey, try this, do that. And you could say, oh, I feel better. That's it. That's all I needed. And I can
Just
walk
needed to talk
away.
to somebody.
Yeah, exactly. Like sometimes you just want to be heard. So
Yeah. Well, Rachel, thank you so much. I'm going to go ahead and just share a few things about upcoming webinars and your conference, but thank you so much. I just want to remind everyone that Resilience Pro is the sponsor of this series of webinars, and a brochure describing this solution is available for you to download through your control box right now during the webinar. Our next webinar will be in 3 weeks on Wednesday, February 17th. We'll be pushing it back a week to avoid a conflict with the Nuka Winter Conference. We'll be further discussing this idea of aspirational healthcare and the model, and diving deeper into how it works. Please join me on Wednesday, February 17th at 10 o'clock Mountain Standard Time. As a reminder, the recordings of all of the webinars that we do are put on the website Going on Offense later on in the day. So come back and look later for that. That website also contains a host of ideas, suggestions, resources, helps for organizations and individuals that want to provide emotional support for people right now during the pandemic or during any difficult time. We suggest that you check them out. Again, I want to just remind everybody about the aspirational conference we're going to be putting on in July, where we'll be highlighting the Nuka system of care and other similar systems that go beyond the traditional deficit-based healthcare system. The representatives from Nuka will be participating in that conference in July and sharing their important insights. If you're interested in learning more, go to aspirationalhealthcare.com. The registration links are not set up yet, but they will be shortly, and you can begin registering for that conference. Rachel, again, thank you so much for being with us today. Really appreciate it.
Yes, thank you so much, Daryl, and I really appreciate you taking the time to, talk with us again and just share with folks the relationship-based care system that we have here in Anchorage, Alaska.
It's my pleasure. All right, we're going to wish everyone a wonderful day. Thank you so much.
Bye-bye.